Good morning, everyone. I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon. On this episode of our podcast, Plastic Surgery Unplugged, I thought I'd talk about facelifts. It's a topic that's very dear to me. I do a lot of facial rejuvenation procedures. And so what I've done is I've compiled, the top 15, 18 questions that I've been asked over the last 18 plus years. So these are questions that I get asked with a pretty big level of frequency. So I've kind of put them all together and said, hey, why don't we create a small podcast about this so that I'm sure if everyone's asking the same question, this may give people a little bit more information about those questions. All right, so let's get started. I'll kind of go through the questions one by one and give you some of the thoughts and my pointers on these questions. So question one, and these are not in any specific order or anything to that effect. So question one, what are the top signs someone might be a good candidate for a facelift? So a facelift is a surgical procedure that's designed to rejuvenate the face, okay? And it's rejuvenating a couple of different things. So I'm going to use my definition of a facelift because I think that there may not be standardization in this. And I think that the facelift actually does three major things. It does the mid-face, jawline, and the neck. These are the three areas that a facelift really targets. So mid-face elevation, sharpening of the jawline, and sharpening of the neckline. So when we look at who's a good candidate for this, I really think that patients who are good candidates have a significant amount of ptosis in this area. Ptosis is the fancy word for drooping. So as we age, these tissues lose the elasticity and they start drooping. So stage one, where there's just a little bit of drooping probably in the midface or a little bit of ptosis in the midface, that may be able to be combated with maybe fillers or fat injection, fat transfer. Now, once we reach a certain point beyond that, where this is starting to really fall and you've got the laxity along the jawline and laxity in the neck, that really is a surgical candidate in my hands. There's no level of filler or fat that's really going to rejuvenate that. That needs to be addressed surgically if this patient wants a long-term result. So long answer to the question, or short answer to the question, is patients that have a pretty moderate to severe amount of droopiness of the midface, laxity along the jawline, and laxity in the neckline are good candidates for a facelift surgery. So question number two, how does a facelift address sagging skin and wrinkles? So when these questions are asked, I think it's also important to kind of give scientific answers to the words, okay? And people use all these things like sagging skin and wrinkles with kind of interchangeability. So I look at this in a couple of different ways. When I say sagging skin, goes back to ptosis. Ptosis means droopiness. So that means that we've lost elasticity in these areas. So the tissues are falling this way, secondary to gravity and loss of those molecules such as collagen and elastin. And then in this area as well, we're basically losing that. We've got the tissues are not as adherent to the underlying structure, so we've got the droopiness and we've got the droopiness in here. So that's sagging skin. Now wrinkles, there's several different types of wrinkles. There are structural wrinkles. So for example, as this falls down, we're going to start seeing this line right here. This is the nasolabial fold or melolabial fold. We're going to see that line, okay? That's a structural wrinkle. Again, when this falls down here, we're going to see this line right here, the marionette line right in here, okay? Those are structural wrinkles. Now, if you've ever seen someone who's got a significant amount of sun damage, they've been hanging around in the sun for a long time, they've got little tiny fine lines and wrinkles within their skin. That's very different than that structural wrinkle. So when we look at this very scientifically, what a facelift is doing is I'm lifting the skin up, getting the underlying muscle layers, and tightening those muscle layers, okay? So that is going to, one, lift up the droopy tissues. So it's going to lift up midface, sharpen jawline, sharpen neckline. It's going to help with the structural wrinkles or structural lines, such as the melolabial folds, marionette lines, those kinds of things. It's going to help with that because the whole reason we have those is because those tissues fell. It's not going to do a whole lot for the little tiny lines within the skin. That's beyond the scope of just a facelift. That is somebody who also needs some sort of resurfacing, whether it be a chemical peel, whether it be laser, something in that category to really target the skin itself, because a facelift is a structural procedure, not a skin procedure. So, how long does a typical facelift procedure take? The answer to this question is extremely variable. It's very, very surgeon dependent. There's a ton of different types of facelifts. Now, I'm going to kind of synopsize this into a very simple, compact way of looking at things. The only way a facelift is really going to last long term is you have to address the muscle layer. Okay, so if you just make an incision in the skin, lift the skin up, pull the skin and sew it up, I could probably do that in about 45 minutes. However, that patient may look great for about a month or two, but long term, they're not going to maintain that result. Okay, so let's say you want a patient to really get that long-term result, which is 10, 12, 13, 14, 15 years. How do we do that? We got to target the muscle layer. That's where the strength layer is. Now, there's different ways of targeting that muscle layer, okay? Less experienced surgeons are going to just grab the muscle layer and kind of pleat it on itself, okay? Lift it and fold it on itself. Moving up on the technology or what the surgeon's capable of is making an incision in the muscle layer, dissecting underneath the muscle layer a little bit, okay? And then pulling it and sewing it. Then at the other end of the spectrum is making an incision in the muscle layer, dissecting all of the attachments underneath that muscle layer that are holding the muscle layer in place, and then lifting. This is what we're calling deep plane surgery, okay? We're going under the muscle layer. We're cutting those little attachments that are holding that muscle layer in place so that it's not being withheld or being fixated. And then we're lifting it and positioning it at the new place. That's deep plane surgery, okay? Now, if you're going to talk about deep plane surgery, which is truly the type of surgery that works long-term, lasts long-term, has the ability to give you long-term results that are natural, all the good stuff that we want, it's really hard to do that kind of surgery in less than about 3.5 to 4 hours, okay? So fast surgeons, I'd say do it in about 3.5 hours. Slower surgeons may take 6, 7 hours, okay? So it's hard to give you an exact time, but you're looking at at least a 4-hour range by the time you do a proper mid-face, jawline, neck, lift the tissue layers, resuspend, trim it, close it, all this kind of stuff does take a little bit of time. All right, moving along. What is the recovery process like after a facelift? When someone asks me this, I can only speak for myself. I cannot speak for everybody else or what other people do. So recovery process for a facelift surgery kind of looks like this for me. We do surgery. You get to go home the same day after surgery. 1, what do you look like when you go home? We put a fancy dressing on our patients where this part is open. They've got this cotton that's kind of applying some pressure to the area to minimize bruising and swelling and fluid collections, and something that looks kind of like fishnet stocking hose, so that it kind of is giving a little bit of pressure. So I send patients home with that, and I also send patients, I probably use drains in about 99% of my patients. So when they go home after surgery, most of my patients are able to walk unassisted, though I don't let them, but they can really truly walk unassisted to their car, get home. And when I question them the day after surgery, they say, I basically went home, chilled out on the couch for a little bit, and then I went to sleep, okay? Pain-wise, most of my patients may take maybe a half of a pain pill that night after surgery. Now, they come back and see me the day after surgery, and I take the dressing off. Initially, they get to see oh, wow, their neck is nice and sharp, and they can really see everything. By about post-operative day number 1 to 2, most of my patients are off of the pain pills. They're probably using some extra strength Tylenol. They're starting to eat regular food and start doing their daily life activities. Facelift surgery isn't very painful because what we've done actually when we do the surgery, if you're in the right plane, you're not really getting a lot of pain. When someone after a facelift surgery that's done well tells you, oh my God, I'm having 10 out of 10 pain, normally that means that something is wrong and the patient needs to be seen, whether it's an infection or a hematoma. So most of these patients are off of pain pills. And their process of healing really goes on. The process of healing from the tissue side goes on for months. But patients are able to usually wear makeup, get back at them, like maybe go to a grocery store by about post-operative day number 7. By about post-operative day number 10 or 11, they're able to wear makeup, do their things, and usually go to work, okay? Now, drains normally come out post-operative day number 3 to 4. The main things that patients usually whine about or say, hey, it's kind of annoying. One is the dressing for the first night. That comes off, post-operative day number 1. And then the drains, because the drains are a little annoying. And I usually leave them in for 2 to 3 days. And after that, they feel a lot better when the drains are out. They can sleep a lot easier. They're able to move their head and kind of do all those kinds of things with a lot less discomfort. So main discomfort is probably for about 3 days after surgery. After that, they're just in the healing process. Big numbers, post-op day 7 probably, get to the grocery store, look pretty normal. Post-op day 10, 11, be able to get to work. All right, how soon can patients see results from a facelift? Okay, as I said, you'll see the initial wow factor post-op day 1. Okay, as soon as I take the dressing off, you get to see the sharp neck, elevated cheeks, all that kind of stuff. You get to see that initial, what it's going to look like. By about post-operative day number 3 or 4 is when the swelling kind of hits. And so patients kind of end up swelling out mainly along the mid-face areas so that their result is really not being able to be seen very clearly. By about post-op day 7 or 8, that swelling has subsided to the fact that they can start seeing a good chunk of the result. By about the 10 to 14 day point, they're looking really good. Okay. Now, is there still some healing going on? Absolutely. There's some healing still going on in the tissue planes underneath, but they can see the result. They can see their tight neck. And I think the first real super wow factor long-term result they get to see is right at about the 3-week point after surgery. All right. How long do facelift results typically last? Okay. Again, very variable surgeon to surgeon. So let's use my hands, my results, my techniques. So we're looking at deep plane surgery. So we're really dividing those ligaments. We're looking at really lifting the muscles appropriately, doing everything you're supposed to do. Okay, so let's caveat this. We're doing everything you're supposed to do. If you do that, facelift surgery results should really last 14, 15 years. Now, what do I mean by that number? So it's not at 15 years everything just falls down. Okay, the results are actually permanent. So let's say someone is 50 years old and they look 50 and they are 50. And I do a facelift on them and I make them look 35. Okay, so basically taken 15 years off the clock. So they're 50 years old, they look 35. So they will continue that 15-year differential for the rest of their life. Now, by the time they're about 65 or so, that 15-year differential for them when they look in the mirror may not be enough. So they may look, 50, 55, they are 65, they're going, that delta, that differential is not enough for me, and I kind of want a repeat facelift. So to the long and the short of it is the results of a facelift surgery done appropriately are permanent. 2, most patients will come in at about 13 to 15 years following facelift surgery and say, hey, can you resuspend, tighten, do something more? Are there any risks or complications associated with facelifts? Yes. So facelifts, like any other surgical procedure, have risks. So if you become a patient of mine, what we will do is I will talk to you about these risks, number one, at the consultation, and let you know the procedures I recommend and what the risks are associated with those procedures. And number two, we will talk about it again at your pre-op. All surgeries, no matter what they are, have a couple of major risks, which are bleeding, scarring, and infection. Okay. However, it is not fair to just say, hey, the risks are bleeding, scarring, infection, and call it as it is. We need to look at what risks are specifically pertinent to facelift surgery. And there's basically two major things that I need to let you know about. Number one is a risk of something called a hematoma. A hematoma is a collection of blood that can occur after surgery. So during the surgery, there's a bunch of small blood vessels. We're also using medicines and things like that in order to minimize these risks from happening and allow us to do surgery. However, every once in a while, a small little blood vessel can open up and bleed after surgery, causing a hematoma. What it looks like is a large collection of blood. It can normally occur right here underneath the ear. That's where it normally occurs. Textbook risk of this happening is roughly in the 4% range. So it's not super common, but can happen. Any surgeon, okay, no matter who he is, who tells you he has never had a hematoma is either lying or just hasn't done enough surgery. If you do enough surgery, you will get a hematoma here or there. It does happen. There's a lot of things we do in the operating room to minimize this risk. So there's things like the drains and the dressing and the stuff that I give you as instructions before and after surgery. My overall risk for a hematoma is less than 1%. So it's not zero, but we're trying to get this as close to zero as we can. The second major risk of facelift surgery is facial nerve injury. Okay, so there's a big nerve in this area. This nerve helps you move your face. It's the important real estate that is in the surgical area as you're doing surgery. The textbook risk of injury to the nerve, if you know what you're doing, is less than 1%. It's about 1.5%, somewhere in that range. My rate of injury to that nerve is 0. Touch wood. Okay, I like to keep it that way. Sometimes you can have some temporary where nerves are stretched a little bit and they can be a little slow to recover for about 3 to 4 weeks after surgery. I've never had a permanent injury to the nerve. But these are the two major risks of facelift surgery that need to be discussed during surgical consultation as well as preoperative appointment. I tell all my patients this just for complete clarity and complete transparency because these risks need to be included on a surgical consent form, and I want you to know what you're signing before you sign that surgical consent form. So, can a facelift be combined with other procedures for better results? Absolutely. A facelift is one of the procedures within this basket that we call facial rejuvenation. Okay, so facial rejuvenation are all sorts of procedures that what we use to turn the clock back. So when you come in for a consultation, the way I look at it is I will ask you, hey, listen, what's your goals? You have a magic wand. Tell me what it is that bugs you. What do you see in the mirror? And I actually just sit there and write notes, okay? And most of the patients say, it's my eyes or it's my neck, and I will write down eyes, neck. So I want to know when you see yourself in the mirror, what are the things that bug you? And in what order? Because normally when patients give me the things as they're explaining it to them, the order that they tell me is the order that they see it. So I kind of look at it from that perspective as well. Then what I do is I examine the patient and I kind of go through top down. The way I think is top down. That's my way of looking at it. And I will create a kind of a comprehensive plan. So when you look at facial rejuvenation, when we age, we don't just age mid-face and neck, okay? So it's rare that I just do a facelift by itself. It happens. If that's the way you age, great. Or if that's what the patient truly, truly wants, fantastic. Okay, but most of the time it's, hey, let's go ahead and clean up your upper eyelids. Okay, maybe we need to lift the brow. So there's a lot of adjunctive procedures that we can do to enhance the overall result. So I look at this kind of in the perspective of, let's say, baking a wedding cake. Okay, so if you're going to bake a cake, it's not just, hey, let's bake the cake. Okay, there's things that you do, right? So you bake the appropriate cake, which is the nuts and bolts of it. But then there is decorating the cake, there's icing the cake, there's stacking the cake appropriately. And all of this is done so that the end result is the best that it can be. So that is what we're trying to accomplish when we do facial rejuvenation surgery. A good example of this is fat transfer. So fat transfer is pretty much an inherent part of facelift surgery in my hands. So when I do a facelift, I almost always, 99.999999999% of the time, do a fat transfer at the same time. Why? So when we age, not only do these tissues fall, but we lose volume. So we can resuspend the tissues, which helps. But if you want to further augment that process, we need to replace that lost volume. And that's what we're really doing with a fat transfer. This is my thought process behind the 4D facelift is we need to include fat transfer within this so that we are really replenishing all the causes of facial aging, which is ptosis or the droopiness, which we're going to fix with the facelift, the laxity in the neck, which we're fixing along doing the neck lift, volume loss, which is the fat transfer. And if we have enough fat left over, I'm going to actually put some stem cells within the skin in order to really enhance skin quality. So this is the bare bone basics of facial rejuvenation and the adjunctive procedures that I put in. There's a whole host of other things that can be done. Lip lifting. You'd be surprised how much lip lifting can enhance the outcome because as we age, we lose lip volume. And you really want to create a natural, balanced result. All right, what are the most common myths about facelifts? Okay, I'll tell you the first one that I can think of right off the top. Everybody thinks that when you do a facelift, looking like this is normal. No, looking like that is not normal, okay? When done well, a facelift looks very natural. You should not look pulled. And people are going to say, well, what happened to this actress or what? I can't answer what happened to these actresses. Some of these things are things gone wrong, patients who may have selected inappropriate surgeons, God only knows. But having done a ton of facelift surgery, when you're done appropriately, number one, it should look natural. You need to look like yourself. Second myth, doing a facelift will make me look like someone different. No. So actually, if I have a patient who comes in and says, hey, I want to look like, and shows me a Hollywood actress or something like that, I'm like, it's not going to happen. Because the goal of facelift surgery is truly, hey, I want you to look like you, but I want to take the clock back. That's what I'm trying to do. Okay? Myth 3. All we're doing is lifting the skin, pulling it back, and sewing it. Negative ghostwriter. There's a lot more going on than just that. What that is really is a skin-only facelift, okay? And I don't do skin-only facelifts because they just don't last. So truly what we're doing is actually lifting, we're making incisions, lifting only a very small portion of skin, making an incision in the muscle, lifting the muscle, releasing it from all of its underlying attachments, resuspending the muscle to where it's supposed to be, putting that muscle down, trimming the excess skin, and then closing it up. So there's a lot more going on. So we're going to wind up just with that for right now. And then what we'll do is we'll probably cover the balance of the rest of these questions in part 2 of our podcast. All right? Looking forward to seeing you guys in just a little bit.